Good day, friends. Namaskar, dosto. I am Dr. Sanjay Kalra, your friendly endocrinologist, and you are watching Dr. KK's Med Talks, Mondays with Dr. Sanjay Kalra. और आज के हमारे नॉन स्टॉप शो का 490वां एपिसोड है, 490th एपिसोड. लेट्स हैव द हेडलाइंस फॉर टुडे. India's daily positivity rate is now at 1.12%. It is still less than 2%, and ये जो phase है less than 2% वाला, this has been maintained for the last 42 days, for the last 6 weeks. However, earlier we were seeing a steady fall in COVID-19 cases, and this has been halted in the post-Diwali week. What this means is that we have to be careful. Social hygiene, social distancing is a must. ये अनिवार्य है. China faces the biggest Delta outbreak as infections grow in one of their northeastern cities. So there is still danger lurking around us. Turkey has updated its quarantine arrangements for travelers from Nepal and India. And the Zydus Cadila COVID vaccine, which was approved recently, will be administered only to adults as of now. So basically, इन सब चीज़ों को देखते हुए, ये है कि हमें अपना ख्याल रखना है. We have to take care of ourselves. We are the only people who can take care of ourselves. कल हमने बात की थी राइट्स की और रिस्पॉन्सिबिलिटीज की. हमारा राइट है कि हम कोविड से बचे रहें, और हमारी रिस्पॉन्सिबिलिटी है अपने प्रति, बाकियों के प्रति, टू आवरसेल्व्स एंड टू आवर लव्ड वंस, टू आवर नेशन, दैट वी सेव आवरसेल्व्स, वी प्रोटेक्ट आवरसेल्व्स फ्रॉम कोविड. In a similar vein, we'll talk about another syndrome, another condition where we can actually prevent ourselves from getting ill. So let's go to our topic for today. हमारा आज का टॉपिक है प्री डायबिटीज, अ प्लेटफॉर्म टू प्रमोट हेल्थ. हमारे आज के गेस्ट हैं प्रोफेसर राकेश सहाय. He is professor and head at Osmania Medical College, a very prestigious medical college in Hyderabad, and he is the president-elect of the Endocrine Society of India. He is the vice president of the South Asian Federation of Endocrine Societies. And ये भारत का परचम लहराते हैं, भारत में नहीं, साउथ एशिया में नहीं, पूरे वर्ल्ड में. Dr. Rakesh, warm welcome to you.
Thank you, warm welcome. Thank you, Dr. Sanjay, for inviting me to be here. It's indeed a pleasure to be here.
So many people logged in, the general public, people who live with diabetes, people who live with other disease, people who take care of people who live with diabetes. Dr. Subhash Grover is with us. Dr. Ramesh Pal Singh Pawar is with us. Dr. Sadanand Shukla is with us. And of course, our global citizen, Vivek Mudgal ji. And all of them say कि आप हमारे medical guru हैं. But Dr. Rakesh, एक बात तो बताएं. In general, when we speak of medicine, when we speak of modern cutting edge technology, we always tend to assume, many of us tend to assume that the West leads and we follow. Hyderabad has a rich history. Any example from Hyderabadi history where actually we led the world and where we created a new medical innovation which was followed by our colonial masters?
Yeah, in fact, about 100 years back, it's not just today, but 100 years back, we recently celebrated 100 years of that when in Hyderabad at the Osmania General Hospital, the first chloroform commission was formed. That is when chloroform was used for anesthesia, and that was actually the first time in the world. And that people from here went and taught others how to give anesthesia and use chloroform for anesthesia.
That is great news actually, and I think we all should be proud of that. 100 साल पहले हमारे डॉक्टर्स, हमारे मेडिकल स्टूडेंट्स, हमारी नर्सेज ने पूरे जगत को एनेस्थीसिया देना सिखाया with chloroform. Of course, now we have much better drugs, but फिर भी ये एक बहुत important चीज थी. And the fact that they were willing to learn from Hyderabad, which at that time was part of India. It was a princely state within India. But Dr. Rakesh, that was about anesthesia. Now we face newer challenges. Yesterday was World Diabetes Day. What is your take on World Diabetes Day? Yesterday we had a med talk with Dr. Nitin Kapoor, who is professor at CMC Vellore. But what is your take on World Diabetes Day and on the theme of World Diabetes Day?
Yeah, so actually World Diabetes Day is basically a not a celebration, but it's a we are observing that day so as to increase the awareness to for everybody to understand what diabetes is, why we should know about diabetes. And the theme every year, IDF comes up with the theme for World Diabetes Day. Earlier it was on women, diabetes in women, then on various complications, how the family should be involved in diabetes in the last year. And this year it is access to healthcare, which means that everybody, whether a rich man or a poor man, or from a good, I mean, a country which is developed versus a developing country, all of them should have access to proper knowledge about diabetes, information about diabetes, and they should have the best treatment available for managing their diabetes. So that was the theme this time. And the tagline with that was, if not now, when? So it's high time that we should take this up and see that everybody knows about diabetes, everybody knows how to prevent diabetes, how to treat effectively, how to manage their diabetes well. So because diabetes is a condition, I think you were already speaking about that. Diabetes is a condition which causes many complications, but it is at the same time it's a preventable problem. It is something which can be easily prevented. Whether it is the complications of diabetes or whether it is diabetes itself, we can prevent that. And that is what has to be known to people, and people should know that and should take action even before diabetes develops, rather than waiting for diabetes to develop and waiting for complications to develop. We should act now and act early so as to prevent diabetes. So that's the theme, and I think I should compliment you for choosing this topic today, pre-diabetes, because that is a stage when actually diabetes can be prevented. That's a stage when we should become alert and we should be preventing diabetes. But unfortunately, what happens is that we do not know about pre-diabetes, because pre-diabetes is not a illness. It's not a any disease state, but it is a biochemical condition. We can say only by measuring the numbers we know that somebody has got pre-diabetes. So it is very important that people should know about pre-diabetes, so that because that's the time when we can do a lot of things to prevent diabetes. We can prevent people from becoming diabetic. We can see that we don't develop diabetes and all the complications of diabetes, and also the heart disease which accompanies diabetes.
सो प्रोफेसर सहाय से बहुत स्ट्रॉन्ग मैसेज आ रहा है। अब मान लो आप दूध गर्म कर रहे हैं, आपका दूध उबल गया और बाहर निकल गया। तो अगर दूध उबल गया, वंस यू द मिल्क इज स्पिल्ट, then there's no point in crying about it. You can't do much. But दूध उबलने से पहले अगर आप उसको देख लें और अपनी गैस बंद कर दें, you can actually prevent. अब बात है नजाकत की, बात है विजिलेंस की। आपका दूध उबल रहा है, आपने उबालना भी है, पर उसको बाहर भी नहीं निकलने देना। Of course, now that is a separate matter. Dr. Rakesh and I in the kitchen, what happens to us when we are left in charge of boiling milk. But still, the point is that we need to be vigilant. Dr. Rakesh also talked about access to diabetes care. इंग्लिश में सवाल पूछा गया, if not now, when? मगर हिंदी में हमारे पास जवाब है इसका, जो कल करे सो आज, एंड डॉक्टर राकेश जो आज करे सो
अब कर।
सो अब करते हैं। एंड अवध की तो किशोर राठौर जी, प्रकाश वधवानी जी एंड सविता भूटानी मैडम ऑल लॉग्ड इन विद अस, और अब के अब लॉग्ड हैं। सो इट्स नाउ दैट वी आर डूइंग, and we spoke of Hindi and English, but Gariga from Hyderabad greeting you in Telugu, saying Namaskaram from Hyderabad, Bagunnara. Sahai garu.
Namaskaram, bagunnanu.
Gariga also reminds us that the Charminar historical monument, this is news for me, thanks Gariga. So the Charminar historical monument, which is so famous, it is the face of Hyderabad for us, it was dedicated to those who lost their lives in the plague pandemic 100 years ago. So that is the foresightedness and the farsightedness of the leaders of the city at that time, who knew how to respect health and how to respect disease as well. So I think they put up this monument to remind all of ourselves to be vigilant in terms of health.
And in fact, if I want to add a little to that, what I would say is that Hyderabad is one of the medical colleges. Usmania Medical College has got 10 different hospitals attached to it. For every specialty, there's a different hospital. Whereas in most other medical colleges, we have a single hospital with all the specialties. In this, we have 10 different hospitals across the state. We have a pediatrics hospital. We have a hospital for obstetrics and gynecology. We have a hospital for ENT, fever hospital. So, I mean, that was the importance of health given in those days.
even 100 years ago, and they knew the concept of specialty also, that
Yeah.
every specialty has its own importance. Aman Singh ji, Meena Gautam, and Mahesh Chauhan ji are with us, and we'll take your questions one by one. But Dr. Rakesh, you just said that pre-diabetes is not an illness. Pre-diabetes में ज्यादातर लक्षण नहीं होते. आपको खुद को नहीं पता चलेगा कि आप बीमार हैं. You will not have any feeling most of the time. डॉक्टर को भी नहीं पता चलेगा. जब वो आपको हाथ लगाएंगे, आपसे बात करेंगे, उनको नहीं पता चलेगा. मगर जब हम बायोकेमिस्ट्री करते हैं, जब हम टेस्ट करते हैं, तब हमें पता चलता है कि दिक्कत है, और दिक्कत होने का अंदेशा भी है, आशंका भी है कि कल को और दिक्कत हो सकती है. सो ये जो बायोकेमिकल डिजीज है, नाउ डॉक्टर राकेश, देयर आर सम पीपल हु क्रिटिसाइज मॉडर्न मेडिसिन फॉर सेइंग दैट वी आर डूइंग अननेसेसरी टेस्ट एंड वी आर creating disease where none exists. So a question is, why are we doing these glucose testings? Are we doing it just for the sake of glucose testing, or are we doing it to prevent something worse?
Correct. So I think what you said, that modern medicine, there are many tests done, many of them don't have a significance. So that is true to some extent. But if you look at diabetes, we have very clear evidence that there is a long phase of pre-diabetes, and that is a phase when we can do something. We have ways of preventing diabetes. जिस बीमारी के बारे में आपको पता नहीं है, जिस बीमारी के बारे में आपको कोई इलाज नहीं है, तो that's a different story. There you may say that this test is not required, or we have done it without any requirement. But here we have very good evidence. We have got very good evidence from so many studies which has clearly shown that this is a stage which progresses. People who have pre-diabetes will certainly progress to develop diabetes. At least two-thirds of them will progress. One-third of them may become normal if they are taking action. And the other thing that we also know is that these people are at the same risk of developing heart disease and strokes as much as in people who have developed diabetes. So this is clear situation where we have got very good evidence, very good proof that by doing something we can prevent a problem. So that is a situation that is different from, there may be many other tests which we don't know about the significance of, that we don't know what we can do, whether we can make a change or not. So that is a different scenario. There are many tests like that, there may be many tests like that, but this is something different. This is something where we have a clear proof, and we are able to say with great confidence that by making changes in your lifestyle, you are able to, no, you don't require medicines. Many times you don't require medicines, but it is only with changes in your lifestyle you can prevent diabetes, you can prevent all the complications, all the problems that are associated with diabetes.
सो ये भी एक स्ट्रांग मैसेज आ रहा है कि प्री डायबिटीज का हमें टेस्ट करना चाहिए, मतलब डायबिटीज का टेस्ट करना चाहिए, बिकॉज अगर वो दिक्कत निकलती है, हम अपने आप को बचा सकते हैं. वी कैन मेक चेंजेस इन आवर लाइफस्टाइल. अपने दिनचर्या में, अपने डेली रूटीन में हम छोटे छोटे चेंजेस ला सकते हैं, विच विल हेल्प अस प्रिवेंट डायबिटीज, विच विल हेल्प अस प्रिवेंट द कॉम्प्लिकेशंस ऑफ डायबिटीज. And Dr. Nanlal Sharda sir is with us. He sends you his blessings from Ahmedabad, Dr. Rakesh. And Aman Sachdeva. Of course, Aman Singh we've already introduced. These are the two handsome Amans of India, both of them. And Aruna Ralanji is also with us. This pre-diabetes, how do we diagnose it? I mean, let us say I just want to know, somebody says, get tested for pre-diabetes. So what tests should I get done? What are the options I have?
Yeah. So what the options that we have is that we can do, suppose we want to do only one single test, we can do the HbA1c, which is the average blood sugar for last 3 months. So in that also we can know if we are doing it from a reliable place, a reliable lab which is giving a good result. Then we know that if it is below 5.7, it is normal. If it is above 6.5, it means it is diabetes. Between 5.7 to 6.5, 6.4, it means that it is pre-diabetes. Now, if you look at the fasting glucose, you can just go to the lab in the fasting glucose state. You can, without eating anything, and you can get a test done, or even with the glucometer, you can do that. When you do that, and if it is less than 110, it means that you are normal. If it is between 110 to 125, it is impaired fasting glucose. मतलब pre-diabetes का एक component है, समझिए आप. So that is impaired fasting glucose. If it is more than 120, 126, that is 126 or more, it is diabetes. सिमिलरली आप अगर खाने के बाद कर रहे हैं, 2 घंटे बाद कर रहे हैं टेस्ट, तो अगर आपको 140 से नीचे आ रहा है, रीडिंग 140 से कम है, तो देन इट इज़ नॉर्मल. 140 से 199 तक इट इज़ प्री डायबिटीज़ और इम्पेयर्ड ग्लूकोज टॉलरेंस बोलते हैं उसको. एंड देन 200 के ऊपर अगर होता है तो then it is diabetes. So clearly we have three different zones, that is आप normal हैं या आप इस mid zone में हैं जिसको pre diabetes बोलते हैं, या नहीं तो diabetes आ गया है.
So three stratification, three layer stratification. One is normal glucose, the other one is pre-diabetes, and then the other one is diabetes. एंड अगर प्री डायबिटीज है, क्योंकि लक्षण ज्यादातर नहीं होते, एटलीस्ट टू नंबर्स हैव टू बी एबनॉर्मल, सिंगल नंबर पे डरे ना आप. एंड in continuation with this, Dr. Noor Aga, who is from Afghanistan, he asks you this question: Sir, can I diagnose a patient as having diabetes only on HbA1c? Supposing there are two HbA1c reports which are abnormal.
Yeah, so HbA1c पे काफी चर्चा हुई है, and there's a lot of discussion on that whether it is reliable or not. As long as it is standardized to a value which is linked to the DCCT value, which most of the kits which are supplied by most of the companies, they are standardized to that. And if it is done properly, then if you get a value more than 6.5, you may repeat it again and see confirm it again with a fasting glucose and a post meal glucose or a post glucose. I mean, after giving a glucose challenge, you can test it again, because that is ultimately required for treatment purpose. You may not be able to treat with just the HbA1c value, so it may help you in categorizing. But whatever it is, what we have to understand is that all these values can change a lot depending on your food intake, depending on the type of at what time you have gone for the test. So they can change a lot. So today, if you get a value of 112 fasting, which you'll be saying that it is in pre-diabetes range, but tomorrow if you make a little change in your life, in your diet, and it may come less than 100. So it is highly dependent on the food that we eat, on the type of exercise that we're doing or type of activity that we are indulging in. Not even severe exercise, even a little bit of walking around and all that may bring down the values. So it only shows that so much of it is dependent on our own lifestyle.
So at least two numbers are required, and we have to be careful also. We have to look at lifestyle. Also, Dr. Noor Aga, stress is another reason which can increase glucose levels temporarily. It can be physical stress, like an illness. It can also be social stress, like
Right.
many of us are facing in many countries of the world now. So, and we pray for Aman and Shanti and peace across the world. Kedar Joshi sir has also logged us and logged in. And let us just go off track क्योंकि game destroyer पूछ रहे हैं. Is there any cure for proteinuria?
Cure for proteinuria? Certainly, the proteinuria, we have to understand what is the cause for proteinuria. Most commonly, diabetics, if you're looking at diabetics, they have proteinuria because of kidney involvement, that is called nephropathy. And if that is set in, still there is, we can bring down the glucose levels, keep a good control of diabetes, control of blood pressure. All these can bring down the proteinuria. Second thing is there can be another set of problems which are specific to the kidney, various types of glomerulonephritis, जिसमें भी प्रोटीनिरिया होता है, एंड उसके लिए स्पेसिफिक मेडिसिन आर अवेलेबल टू ट्रीट दैट.
So आपका ACR है 1900, which is a bit on the higher side.
Yeah.
They will certainly do some test, and if your doctor asks you to do a kidney biopsy, just get it done. अगर वो कहते हैं तो, of course, अगर diabetes है, poor control of diabetes है, first we will manage that. But certainly it can come down, and you don't need to worry. That is the very aim actually of this episode today of KK's Med Talks, that we take action in a timely manner. Ratnesh Jain ji bhi hai hamare sath, and Dr. R.S. Chaudhary sir is a senior surgeon, he's with us. So the point is now that we know how to test for pre-diabetes, but then who should test for pre-diabetes? Aman Sachdeva is 20 years old, 28 years old. Aman Singh ji is 42 years old. Should both of them go for a pre-diabetes test? Somebody has a family history, somebody is obese. सबको पूरे इंडिया को कराना चाहिए प्री डायबिटीज का टेस्ट या किसी किसी को?
तो दो चीज हैं इसमें. वी हैव टू अंडरस्टैंड टू एस्पेक्ट्स टू दिस. one aspect is that because diabetes is very common, it is a silent disease. It is important that all of us get a test after the age of 30 in our country. In most of the western countries, where they have a diabetes starting at least 10 years after what it happens in our country. I mean, the average age in western countries is 50-51 years, whereas in our country it is 10 years or younger than that. So that's why what we are saying is that, and then very often we see many people in their 30s having diabetes without knowing about it. So that's why what most experts in India have felt is that 30 is a good cutoff age. Above 30, everybody should have a glucose test done at least once. And
Yeah.
if it is normal, they may repeat it after 3 years. But otherwise, at least once, almost everybody above the age of 30 should have a glucose test. So that is what most experts in India feel.
So everybody who is listening to us, India, Nepal, Afghanistan, Bangladesh, हमारे लिए साउथ एशिया के लिए 30 years and above. So if you are above 30, do get a glucose checked. Fasting and post glucose, या fasting and post prandial, या HbA1c, whatever is convenient to you. एक
So,
रिपोर्ट अगर abnormal, या
yeah, I mean, you can complete that. Sorry.
एक रिपोर्ट अगर एबनॉर्मल आती है तो दोबारा टेस्ट करा लें, या वही वाला करा लें या कोई डिफरेंट टेस्ट करवा लें ग्लूकोज का. बट इफ यू आर अबव 30, यू मस्ट गेट इट डन. इफ यू नो एनीबडी हु इज अबव 30, प्लीज रिक्वेस्ट देम टू गेट द टेस्ट डन टुमारो.
Yeah.
So now
What I
this
was
would be, yeah,
what I was
yeah,
actually adding was that now what about those below 30? Should
yeah.
everybody get a test? So the question is that those below 30, now what you should do is see whether you have risk factors. Suppose you're overweight, your weight is more than what should be the ideal weight, or if you have got a strong family history, that is both your parents have diabetes, or if you have developed blood pressure. There could be some people in 20s and 30s, or 20s and below 30 also, who have developed blood pressure. And so such people should also go for a test, and because they can also be at risk of developing diabetes.
So everybody above 30 and people below 30 who have risk factors. Let us remember some risk factors. H for heart disease, H for high blood pressure. अपनी ग्लूकोज जरूर चेक करवाएं. O for obesity, O for another disease called OSA, obstructive sleep apnea, जहाँ पे आप खराटे बहुत मारते हैं रात को. आप तो खुश रहेंगे, पर जो साथ आपके सोए हुए हैं, they are upset with life. L for liver disease, fatty liver. L for lipids या cholesterol. D for darkening of skin, suddenly आपकी skin dark होनी शुरू हो गई, especially around the neck के पीछे. And D for any other disease. In all these, and also if you have a family history of any of these diseases, then even at a younger age you should get your glucose checked. Daksa, we spoke about D for disease. जब हम बात करते हैं disease की, we always tend to think of chronic disease, long term disease, metabolic disease, heart, diabetes, kidney, बस यही बात करते रहते हैं. But आपकी ओपीडी में कितने लोग आते हैं with chronic disease, कितने आते हैं with acute disease? अचानक किसी को डेंगू या कोविड हो गया, किसी को हो गया जेनिटल ट्रैक्ट इन्फेक्शन, सेक्सुअली ट्रांसमिटेड डिजीज, यूरिनरी ट्रैक्ट इन्फेक्शन, किसी को हो गया ट्यूबरकुलोसिस या हेपेटाइटिस. दीज आर अक्यूट इलनेसेस जो अचानक आती हैं, इन्फेक्शंस होती हैं. इनमें भी हमें ग्लूकोज चेक कराना चाहिए क्या?
Certainly. In fact, there was a discussion that we should call it as one of the vital signs. Glucose as one of the vital signs. We can even call it as a fifth vital sign. मतलब जैसा आप बोलते हैं कि किसी भी मरीज को उसका ब्लड प्रेशर चेक करना है, उसके पल्स रेट देखना है, और उसका टेम्परेचर देखना है, तो वैसे ही जो है और एक पैरामीटर जो ऐड करना चाहिए ये है कि ब्लड शुगर भी चेक करना चाहिए.
Right. So now we know how to check glucose. We know who should get their glucose checked to rule out pre-diabetes, and who should get it checked. एक तो everybody above 30, and also if you are at risk of chronic disease, if you have any other chronic disease, but also if you have an acute disease, अचानक कोई दिक्कत आई. मान लो किसी को मलेरिया हो, तो तब भी ग्लूकोज चेक करना चाहिए जब मलेरिया की दवाई दे रहे हैं. और उसका रीजन क्या है डॉक्टर राकेश?
उसका रीजन ये है कि मलेरिया की दवाइयों से भी ग्लूकोज लेवल कम हो सकता है. बढ़ने के व्हाइल वी आर स्पीकिंग अबाउट हाई ग्लूकोज, यहाँ पर ये होगा कि ग्लूकोज लेवल्स कम हो जाएंगे मलेरिया की दवाइयों से. तो इसीलिए ज़रूरी है कि ग्लूकोज टेस्ट करना है इस सिचुएशन में.
सो जब हम डायबिटीज या प्री डायबिटीज का चेक करते हैं, ऑफ कोर्स वी आर मोस्टली थिंकिंग अबाउट हाई ग्लूकोज, बट it is also possible that we might detect low glucose, and that will also help our patient improve his or her health. So we've diagnosed pre-diabetes now. अब आगे क्या होगा? So we are getting a lot of questions, Dr. Rakesh. Mohammad Rashid ji complimenting you, saying great work, sir. Game Destroyer नाम बड़ा अल्टीमेट है गेम डिस्ट्रॉयर, एंडी नाम है। आर यू फ्रॉम हरियाणा? कहाँ से हो? गेम डिस्ट्रॉयर। सो नाउ अब मैं अपने पे ही हंस रहा हूँ, व्हाई डिड आई फील दैट यू आर फ्रॉम हरियाणा? सो बट अरे, एंड केदार जोशी सर वाज अनवेल, इनको डेंगी फीवर हुआ एंड ही वाज एडमिटेड फॉर 5 days, बट ही हैज कम बैक यस्टरडे। वार्म वेलकम सर, आप हमारे डेंगी वॉरियर हैं, और बीमार मत हुआ करें, अच्छा नहीं लगता। So, but best wishes for a speedy recovery. And आप अपना खाना पीना का ख्याल रखें सर, and don't go into intermittent fasting. And so any comments for for Joshi ji? Sir is a senior citizen. Dr. Rakesh, how does he get well soon now from dengue fever?
No, I think he should uh, start with little physical activity, gradually increase his physical activity, have a healthy diet, and take adequate protein intake in his diet. I think that is going to help him very well.
And another good news is from Gariga's home. Gariga के friend की wife, she was antenatal and diabetes भी थी. She was on insulin. But 3 days ago, she has given birth to a healthy baby boy. So congratulations to the entire family.
That is very nice. So,
Uh,
and this context, let me also tell our viewers that जिसको भी प्री आई मीन जेस्टेशनल डायबिटीज होता है, मतलब जैसा अभी अभी जो डिस्कस कर रहे हैं अपन, तो उन इनको सबको, इन्हीं सभी को भी डायबिटीज आने की संभावना ज़्यादा है। तो इनको भी प्री डायबिटीज होने की संभावना ज़्यादा है, तो इनको भी टेस्ट करना है, कंटिन्यू करना है टेस्ट, मतलब एवरी ईयर दे शुड टेस्ट and see that they prevent diabetes, because this is a group of women who have a very high risk of developing diabetes later on, and they should not forget about the fact that they can develop diabetes, and they should be preventing diabetes.
so Gariga had asked this question, what are the precautions? So the precautions are you keep on getting tested, getting assessed every year, and just
And
follow a healthy lifestyle.
healthy lifestyle, healthy diet, and see that you come back to pre-pregnancy weight. That is
Lose
another
weight.
important issue.
Dr. Rakesh, what about breastfeeding? Will breastfeeding worsen diabetes, or is it a preventive therapy to prevent diabetes in the
Yeah,
baby, in the mother?
yes, breastfeeding is very good for the baby and also for the mother, because it gives the opportunity to the mother to lose weight and come back to the pre-pregnancy weight, and thereby, it is very helpful to them to prevent diabetes also.
Aruna ji has a question, a very practical question. Pre-diabetes hai, but I don't like sugarless tea. So what sweeteners can I use, and what should I not use?
Well, there are different sweeteners available, and all of them have been reasonably safe. All those that are there in the market, all the problems that we hear of are only when they're used in very high doses. So, as long as you're using 1 or 2 tablets of whatever sweetener you're using, whether it is sucralose, whether it is aspartame, whether it is stevia, 1 or 2 tablets of that in a cup of tea, or when you're taking more than 1 or 2 teas in a day, that is not going to make any difference. But if you're taking it more than many tablets every day, more, say, maybe 10-15 tablets more than that every day, then you should be watching out for that, because but the upper limit is much higher than what we are speaking of. But what we are saying is a reasonable limit is 10-15 tablets, not more than that in a day. So if you're taking 1 or 2 cups of tea with 1 or 2 tablets of the sweetener, it is not going to cause any harm.
And you can also try other alternatives, non-sweetener alternatives. So, Aruna ji, why don't you try dalchini? The English word for dalchini is cinnamon. Uh, Basically, sugar is meant to tickle your tongue, to tickle your taste buds. Dalchini try करके देखें. Try ginger. That's another good idea. So just keep on trying these various spices in your in your tea. My favorite is dalchini or cinnamon. My dad makes the best tea in the world, especially the cinnamon tea. Try that and then see what happens. Within a few weeks, you will develop the taste and you will not want to eat sugar anymore. You will
Yes,
not want to add sugar to your tea.
that
Dr.
is another
Rakesh,
very practical way of looking at it, because many people can do away with the need for sugar.
and also the artificial sweeteners.
Yes, and
Adrak,
also that's what I'm saying. That's what I'm saying.
adrak या दालचीनी, ginger या cinnamon. And one of my patients, Uncle Ji is about 80 years old, Mr. Jain. He lives in the Haryana city of Jeend. he makes a very good chai masala, but he has never I've been taking care of him for the past 15, 20 years. He has been taking care of me for the past 15, 20 years. Every winter he sends me the chai masala. So I'd like to I doubt if he is listening to me today, but I'd like to thank him. The best chai masala comes from Jeend. But वो अंकल सीक्रेट नहीं बताते अपना. He never tells us a secret. Stevia is good to use, and
Yeah,
stevia we can use, Kedar Joshi sir. And Savita Bhutani ji पूछ रही हैं, what about brown sugar? Does that have calories?
that has calories. It is not free of calories, so it has calories, although it is said to have a lower glycemic index, but it has got the same calories.
And Game Destroyer is from Uttar Pradesh. तो वो भाई भाई वाला स्टेट है, सेम IQ है हमारा. But ये English speaking है यूपी से. So that is something to be very careful about. Many people, Manish ji, Aman ji, other people also asking, pre-diabetes diagnosed हो गया. Now, what is in store for us? Can we reverse diabetes? Can we have diabetes remission?
Yeah, pre-diabetes detect होने के बाद, I mean, you can always reverse that, because we have said that most people can actually reverse pre-diabetes. And what we are speaking of remission or reversal, it is very much likely in pre-diabetes more than what can happen with diabetes. So I think it's much more easier in the stage of pre-diabetes. That's why we are saying that detect in the stage of pre-diabetes, because you can reverse, you can bring about a remission much more easier than if when you've gone on to develop diabetes.
So actually aim ही यही है pre-diabetes diagnose करने का. We diagnose the condition before you fall ill. We take action. We include interactions. ज्यादातर ये बगैर दवाइयों वाली interactions होती हैं ज्यादातर. And उसके साथ you can actually reverse the pathophysiology. You can reverse the disease and you can prevent yourself from getting diabetes. अगर आपने diabetes prevent कर ली, तो you will be able to prevent yourself from getting the complications of diabetes. So aim ही यही है कि हम चुकन्ने रहें. तो जो कल करना है सो आज, जो आज करना है सो अब. Now, Dr. Rakesh, we said that lifestyle is the first line of treatment, and that is right. Lifestyle की तो बात चलती रहेगी. But are there any drugs which can be used by people with pre-diabetes? So can you just list some of the drugs which are being used in India and
So,
abroad?
although we have said that lifestyle is very good, but there can be situations where people may not be able to make a change. They may have a problem. They may not be able to move around much. So in such situations, there have been many drugs which have been tried. First amongst them, I think the most important amongst them is metformin. Metformin is again a drug for diabetes. It's a very good drug for diabetes, which is used as a first line for treatment of diabetes. The same metformin, because it does not cause hypoglycemia, because it does not cause sugar to go below normal, it will reduce only the level to the level above which it is below above normal. So metformin, because of its mechanism of action, which is such that it does not cause hypoglycemia, it is a very useful drug. It has been tested in many studies, where it has been shown that it is next only to physical activity. The next medicine is probably metformin, and that has been used. It is also a medicine which is used very often in women who have got polycystic ovarian syndrome. So they don't have diabetes, but they require this medicine. So metformin is a medicine which has been used even in people without diabetes in many situations, and pre-diabetes is one of the situations where it is found to be very good. In Although we have got, all the studies have shown that probably lifestyle changes, if you are able to do them, they are much better than metformin. But if you are not able to achieve that, then metformin is the next best medicine that we have. There are other
Metformin
medicines that have
is
been tried.
very economical, also very safe. You can use it in people without diabetes. Already, it is being used in people without diabetes. So that is one drug. Uh, Sir, another question is from Aditya Sharma, who says, "Can I use pioglitazone in diabetes? Can I use pioglitazone in pre-diabetes? And
Pre-diabetes.
chances of bladder cancer? Should we worry about that?"
Yeah. So there are many more drugs which have been used in pre-diabetes, because basically pre-diabetes में ये हो रहा है कि इंसुलिन रेजिस्टेंस बढ़ जा रही है. मतलब इंसुलिन जो पैंक्रियाज में बन रहा है, एक पर्टिकुलर क्वांटिटी जो बन रहा है, वो जितना इफेक्ट होना चाहिए उतना नहीं हो रहा है इंसुलिन का. तो इंसुलिन रेजिस्टेंस हो रहा है, मतलब इंसुलिन बराबर काम नहीं कर रहा है. तो उसके लिए मेटफॉर्मिन एक एक मेडिसिन है जो अच्छी अच्छी तरह से काम करती है. और दूसरी मेडिसिन ये है पायोग्लिटाजोन, जो पायोग्लिटाजोन इंसुलिन रेजिस्टेंस को कम करता है। और इसीलिए पायोग्लिटाजोन अच्छी दवा है, मतलब उस मैकेनिस्टिकली, मतलब यानी उसका मैकेनिज्म अगर आप अपन समझते हैं तो मैकेनिज्म में अच्छा फिट होता है पायोग्लिटाजोन। एंड ऑल द स्टडीज हैव आल्सो शोन दैट pioglitazone has got a good effect in reducing the insulin resistance, and in pre-diabetes it has an important role to play. There are some studies which have also shown that it reduces the stroke and cardiovascular disease amongst people with pre-diabetes. So it is good. There are some problems with pioglitazone, that it can cause a little weight gain, and there was some concern of bladder cancer, but it has been clearly shown in different studies across the world, follow-up studies. A lot of data has come that shows that bladder cancer is probably not a important risk factor for a risk with pioglitazone. So this has been cleared from by various organizations who have clearly looked at all the data and said that this is not a problem that is happening because of pioglitazone.
So the first line would be metformin, unless of course there is a reason not to use it. Pioglitazone is a good drug to use, and Aditya, we can use it safely for a long period of time. It actually increases good weight and reduces bad fat cells, and it helps in many other ways as well. Other people also logged in. Dr. Mohan Shenoy, who is a leading endocrinologist from Trivandrum, is logged in with us today. So warm welcome, Dr. Mohan.
Yeah,
And
welcome.
Dr. Noor Aga and Dr. Ramesh Pal Singh Pawar asked the same question. What about Jaggery? Noor, Jaggery is an Indian sweet, unrefined sugar, which is brown in color. The Hindi word is good. So, can we use good or Jaggery? Or in Odisha, we get palm sugar, brown colored palm sugar in Odisha. And Seema Bindru is also with us. I'm sure she is a perfect chef when it comes to using palm sugar and good and sugar separately. But no, these things actually make you think a lot about sweets. But are these safe or should we avoid them?
Yeah, so what people should know is that, because they think that whatever is white is bad, whatever brown is good. So it is not 100% true. It's not very true that if you use jaggery in whatever quantity you want, you can be I mean, it will not cause any rise in blood sugar. It is okay to some extent, as in a small quantity you can use it, but the larger quantities of that also is going to have a significant effect on the glucose levels. That is what I would say. Dr.
Yeah.
Sanjay would add to it. Yeah.
Hmm. And Game Destroyer tells us that jaggery does have minerals, but it is still a venom or a poison for people with
Yeah.
diabetes.
Yes.
There
So
are
that.
also, yeah, there are questions related to biochemistry, if we can take them. But before that, a simple question again from Dr. Noor. What is the maximum dose of metformin?
Yeah.
And what do
So
you use in your practice?
yes, maximum dose of metformin in people with diabetes, we use the maximum dose that can be allowed is up to 2.5 grams. Most commonly, we don't use more than 2 grams. Most of our patients who are tolerating metformin, they're on 2 grams of metformin. In pre-diabetes, we may use lesser doses. We may use just 1 gram of metformin, that is 500 milligrams twice a day. We may use. If we may go a little more, we may go up to 2 grams. But most of the times in pre-diabetes, we would go just about 500 mg twice a day. But in managing diabetes, we go up to 2 grams.
2 grams. And some books say you can go to 3 grams, but there will not be too much of an extra benefit.
Extra benefit.
Unless your patient's main complaint is, I want to reduce my appetite, I remain hungry all the time, then giving high doses of metformin makes them less hungry. Seemaji says that cinnamon actually helps a lot, so we should use it in our cooking. It helps reduce the craving for sugar. And many questions from Vaishali ji, from Puneet ji. Let me just put them all together. Uh, we speak of fasting glucose and daytime glucose. For daytime glucose, we use other names, postprandial or post meal. So, why is it, Dr. Rakesh, that some people have relatively higher fasting glucose, other people have relatively higher post meal glucose? So, could you just explain in simple
Yeah.
words?
So, to understand this very simply, what we can say is that glucose levels are maintained in a normal, I mean, a very narrow range between 100 to 120, we can say, or even less than that, even we can say from 80 to 110 or so. in normal people. And whenever they eat food, it goes maybe going up to about 120 or so, and then comes back to about the come back to around 100 or so. Now in people with diabetes it becomes higher. It crosses that 140, and we said even it crosses the 200, and therefore we call them as having diabetes. Now why do some people have more fasting glucose? Why do they have? Because the mechanisms, or the mechanism which control the glucose level when the person is not eating, is mainly by the production of glucose in the liver. So that if it is happening to a larger extent, then that person will have more of fasting glucose levels. Now after food, when the glucose level is not rising in a normal person, but in a diabetic person it is rising, it is because the various other tissues like the muscle, the fat, they are picking up the glucose in the once a person eats. If they are not able to pick up because of insulin deficiency, then the glucose level goes up. But if they are able to pick up very well, then the person will have a normal glucose levels. So that's the reason. Where is the problem? If the problem is more because the liver is producing more glucose, it's not getting stopped, then the person has more of fasting glucose. If the uptake of glucose by various other tissues is less, is slower, then the person will have higher post meal glucose values.
उसमें सो इंसुलिन जो है हमारे पैंक्रियास से, हमारे अग्नाशय से इंसुलिन बनती है. इंसुलिन इज अ हार्मोन, ये ब्लड में घूमता है. थिंक ऑफ इंसुलिन लाइक अ की, एक चाबी की तरह. ये चाबी अलग अलग ताले खोलती है. दिस की ओपन्स वेरियस लॉक्स. लॉक्स पूरी बॉडी में हैं, वी कॉल देम रिसेप्टर्स. बट मेन 3 ऑर्गन्स हैं बॉडी में. वन इज द लिवर, the second is the fat cells, the fat tissue, and the third is the muscle, skeletal muscle. जो फास्टिंग ग्लूकोज है वो लिवर से आती है. तो अगर लिवर के ताले जाम हो जाएं, the liver receptors, the insulin receptors become resistant, then fasting glucose will rise. Fasting glucose is usually not linked with lifestyle, usually. However, if you have a sleep disturbance, if you are going to indulge in a lot of substance abuse at night, read alcohol for that. And if you have a lot of stress, stress is associated with sleep disturbance. If you are a shift worker, if your spouse gets it into her head or his head to keep on nagging you throughout the night, then your fasting glucose may rise. But ज़्यादातर fasting glucose का lifestyle से link नहीं है, unless you are a shift worker, unless you indulge in a lot of substance abuse, and unless you have a sleep disturbance caused by a spouse or by something else. On the other hand, जो daytime वाली glucose है, that is more linked with uptake of insulin in the muscles and in the fat. It is linked with what you eat, how you behave. तो जो दिन की जो ग्लूकोज है उसका लाइफस्टाइल से ज्यादा लिंक है. जब आप अपना लाइफस्टाइल ऑप्टिमाइज करेंगे तो दिन की शुगर ज्यादा डाउन आती है, फास्टिंग ग्लूकोज इतनी डाउन नहीं आती. एंड सीमा जी एंड मोहम्मद राशिद साहब बोथ आस्क यू द सेम क्वेश्चन. डायबिटिक मेडिसिन खाने से गैस बहुत बनती है, तो ये मेडिसिन से ही बन रही है और कोई कारण है? मैं क्या करूं? मतलब राशिद साहब पूछ रहे हैं व्हाट शुड आई डू.
Some people have a problem with the medicines. They are not able to tolerate, particularly metformin भी ऐसी दवा है जो कुछ लोगों को, मतलब 1-2% लोग हैं जो जिनको उससे प्रॉब्लम होता है, मतलब गैस्ट्रोइंटेस्टाइनल डिस्टर्बेंसेस रहते हैं. सो दे आर नॉट एबल टू टॉलरेट दैट. बट most other people do not have a problem with the medicines. They are able to tolerate the medicines, and they should continue the medicines. जिनको प्रॉब्लम हो रहा है उनको रोक के देखना है. अगर दवाई रोकने से अगर कम हो जा रही है, आपको प्रॉब्लम कम हो जा रहा है, तो इट मे बी रिलेटेड टू द टैबलेट. And if you reintroduce the tablet, if it is coming back, then it is certain that it is because of the tablet and it's not because of other factors. But there can be other factors which are causing that. That's why we should first confirm whether it is because of that medicine only.
Common reasons in North India will be drinking too much of milk. So lactose intolerance. दूध पीने से गैस बनेगी, मगर अगर आप दही खाते हैं तो फिर इतनी दिक्कत नहीं आएगी आपको. लस्सी पियेंगे तो दिक्कत नहीं आएगी. सो थिंक ऑफ लैक्टोज इंटॉलरेंस. दूसरा, इन्फेक्शंस. जो परजीवी हैं, प्रोटोजोआ हैं, उनकी भी वो जो जब इन्फेक्शन होती है हमें, प्रोटोजोअल इन्फेक्शन या परजीवी वाली इन्फेक्शन, उससे भी गैस बनती है. तो उसमें 3 या 5 दिन की दवाई लेनी होती है. तो डू स्पीक विद योर डॉक्टर. But what about the preparation of metformin, Dr. Rakesh? Supposing one type of metformin is not suiting you, can you change?
The metformin, since it comes in different formulations, like the extended release formulations, most of the preparation of metformin are now available in extended release formulations, and they are probably less irritant in the gastrointestinal tract than the quick release formulation, the normal release formulation. So many times people may tolerate the extended release formulation. Those who are not tolerating the regular metformin may tolerate the extended release form, or the SR formulation. They may sustained release formulation. They are able to tolerate that. So I think we can change to that also and try that also before we say that a person is not completely not tolerant to metformin, and then we need to change the medicine.
यूज बेटर क्वालिटी मेडिकेशन. जब आप मान लो चावल खरीदते हैं या आटा खरीदते हैं, सो देर आर डिफरेंट क्वालिटीज. सेम थिंग हैपन्स विद मेडिसिन. So do remember to buy medicines of good preparation, of good quality, and confirm with your doctor also whether what the chemist has given you is right or wrong. Gariga ji has a question for you which only you can answer, Dr. Rakesh. तो गरिगा जी कह रहे हैं कि in the old city of Hyderabad, the second wave of COVID didn't trouble us too much as compared to other cities. Is it because of the fact that we use a lot of spices? And the old city of Hyderabad is famous for biryani. Gariga, why do you make me hungry all the time? And it's famous for biryani, and the masalas that are used in the biryani help fight COVID.
Now, I think the second wave of COVID, in fact, actually affected most of the people, even in Hyderabad and even in the old city of Hyderabad. But the important difference was that it was less severe, because by that time many people had received vaccination, and we had less severe disease. And although more people were affected, but the severity was less. So probably many people perceived that it was less and not as bad as the first wave.
Yeah.
I think that was
And
the scenario even in most parts of the country.
but do encourage everybody, Gariga, to get vaccinated and
Yes,
to continue to
definitely.
follow social hygiene. And we have still not seen the back of COVID because dunya to ek hai, the world is one, and you see that newer epicenters are coming up in Europe, in China, and they can also travel to us. And
Yes,
then these we have a Delta variant now, but we may have newer variants in future, so we should be careful.
and very important
Sayyid,
that everybody should get vaccinated. Everybody should get vaccinated.
Sayyid Hafiz साहब पूछ रहे हैं कि we you gave us criteria for fasting and for 2 hour post meal or post glucose. Is there any criteria for 1 hour glucose? And in what situations do we check glucose 1 hour after a meal?
Yeah. So 1 hour we don't have any criteria in the diagnosis, but we can use it for certain situations, like in pregnancy when we are looking at the blood sugar levels. 1 hour value is very important because that correlates very well with the problems that happen in pregnancy with high sugar. That is, the babies can be born with a higher birth weight. So that correlates very well with the 1 hour value, and that may be useful in pregnancy, testing in pregnancy. Other times we may not use it that much. In some research settings, I mean, some people have said that 1 hour value may correlate very well with the risk of developing diabetes later on. I mean, if somebody has got a higher 1 hour, then probably he has a higher risk than a person who has got a higher 2 hour value in terms of getting diabetes later on. But that is all in the research setting, not very clinically applicable and not relevant practically possible. So only in pregnancy we may check the 1 hour value, because that may give us some important information.
Kedar Joshi sir shares a success story with us, and I think we should all be inspired by him. 30 years ago, he had high BP and also high cholesterol. Then he developed pre-diabetes. He stopped his cholesterol medicine that helped him reverse the diabetes, and he also started yoga. So, with that, he has been able to manage his blood pressure and his cholesterol and his glucose just with yoga and a healthy lifestyle. So, ek to sir, hats off to you. We salute you, and I think that is the inspiration that we should carry from today's message, from
Yes, I
today's
think talk,
talk.
yeah, talk show. I think that's the biggest message. He has given us the inspiration and the role model. He's a role model for us, we can say, for everybody who's listening today. Kedarji is a role model, because he has not done it for a few days, but 30 years he's been able to be without medication, and he's able to prevent diabetes, because he developed pre-diabetes 30 years back, and today also he's not diabetic. That means that, that so much is possible to be done with just lifestyle changes, and that is why I think we should all salute him and follow him.
Yeah. And but अगर first step देखें तो how did the opportunity arise 30 years ago? What is the first thing that Joshi साहब got tested? स्टोरी तो वहां से स्टार्ट हुई ना.
हाँ.
He got his blood pressure and cholesterol tested first.
Yes, yes.
Yeah. अगर
So
हम
it
वो
is
ना टेस्ट
important,
कराते.
correct,
Yeah.
important message that we should test. अगर वो नहीं करते, टेस्ट नहीं करते, तो पता ही नहीं चलता था. He would have probably developed diabetes, developed one of the problems of diabetes. He would have probably, I mean, a person like him, I'm not saying he, but any person like him who had not tested, who would probably get up one morning with a heart attack, and then he goes to the hospital, and sees that he already has diabetes, he has blood pressure, he has high cholesterol, and he has come to the hospital with a heart attack. That's the usual story that happens many a times. Had he not checked, maybe a couple of years later, he would have developed that.
So that is the first step जहाँ पे जोशी साहब ने सही किया. He got himself tested for glucose, cholesterol and blood pressure. उसके बाद जो सेकंड चीज ठीक की जोशी सर ने, वो he didn't lose hope. He went into action mode.
Correct.
He took the pre-diabetes as a platform to improve health, as an opportunity to improve health. तो इन्होंने एक्शन क्या ली? इन्होंने अपना लाइफस्टाइल बदला, योगा स्टार्ट की. That's the second thing that we should look at. And the third thing is उन्होंने इसको मेंटेन किया. He has made it a part of his life. अपनी दिनचर्या का, अपने डेली रूटीन का हिस्सा बना लिया केदार जोशी सर ने इसको. So I think these are the three take homes that we take from Joshi sir's story.
Yes.
Honey and Jaggery to abhi we just answered, and honey is also equally bad. उसमें खूब calories होती हैं. Many questions coming on COVID-19 and coexisting in harmony. There is actually a concept of one health in the world. One health ये कहता है कि हमारी जो human beings की health है, that is linked to the health of all the plants and animals. So game destroyer, game को destroy मत करना please. Game का ख्याल रखना. Take care of all the plants and the animals around you. उनकी health में ही हमारी health है. So that is the concept of one health. डॉक्टर आर एस चौधरी सर पूछ रहे हैं, why do people with diabetes get pain in the feet at night? Why does the burning feet increase at night?
That is because they have neuropathy, मतलब यानी कि diabetes की वजह से the nerves have been affected, and the pain which is there is because of the pain in the daytime is not perceived, because it's not that the pain increases at night, or the pain or the activity of the nerve in the nerves is increasing at night. It is because during the daytime, when the person is occupied, he may not perceive that pain. He'll be preoccupied with his work and all that. When he's sleeping at night, that's the time when the pain sensation becomes more prominent.
So this is a sign of nerve disease. If it had
Now,
been muscle disease or joint disease or bone disease, that would be more on exercise, on exertion. Speaking of functional foods, Asha ji पूछ रही हैं, Asha Luthra madam asks, can methi dana help in diabetes and pre-diabetes? And what other functional foods can we use?
yeah, I think those are very good functional foods which have a very low glycemic index. यानी कि they don't cause a significant rise in glucose after you consume that, and they provide us with many important components in the diet, and at the same time they don't increase the calories in the diet. So that's why they are good functional foods.
But the good thing about today's episode is, today's talk show is, Dr. Nanlal Shada raised the point. How do we motivate our patients to take action when they are diagnosed to have pre-diabetes? So, ek to we have these wonderful stories coming from Kedar Joshi ji, also from Game Destroyer. He got himself tested, he got his papa tested, and he was diagnosed to have pre-diabetes. And then they have been able to take care of themselves. But जो सबसे, I think जो first limiting factor है of managing pre-diabetes, that is to create momentum about the awareness कि ये condition exist करता है. The condition exists. It is very common. More than 10% of Indian adults have pre-diabetes. 1 out of 10 has diabetes. Another 1 out of 10 has pre-diabetes. So total हो गया 20%. In a state like Haryana, this goes up to 35%. And in a state like Kerala, it goes up to 60%. So it's common, but you can actually take action. You can prevent disease, you can prevent complications. Speaking of drugs, there will be some situations where your doctor may ask you to take drugs for prediabetes. We've talked of metformin, we've talked of pioglitazone, and also in the chat box,
Acarbose. Yeah.
yeah,
There are
one
few
of
more
our
drugs like acarbose is another drug, or alpha glucosidase inhibitor as we call it. They are also very good drugs for pre-diabetes. Even some of the newer drugs which have come in very recently, like the SGLT2 inhibitors, which are very good from the heart and kidney point of view, they are also very useful in pre-diabetes. Although we are still awaiting data on that, but they are also useful drugs for pre-diabetes. Even DPP4 inhibitors have been shown. So most of the drugs have been shown to have good effects in pre-diabetes, and they can be used in situations where lifestyle alone is not enough.
Amrit Kumar Dhakal has also shared a nice post with us and told us about these newer drugs. So thank you, Amrit, for that. Dhakal is a Bhutanese surname, if I'm correct. So Amrit, it would be nice. Where are you from? It's nice having you on the show. But if your pre-diabetes is severe, the numbers are closer to the diabetes range. If you have symptoms, like Dr. R.S. Chaudhary said, burning feet, this can be a symptom in pre-diabetes. And a question was raised by Amanji, can I take Neurobion Plus or Neurobion Alpha D or Neurobion for a long time? Yes, you can. It is a safe medication. It actually helps optimize the nutrition of your nerves. And in our Indian diet, we don't get too much of
Wheat
food
bread.
which is free from pesticides. And also, I think it is a good idea to take that. You can continue taking. So, if you have severe pre-diabetes, if you have symptoms, you have any sickness which is not getting resolved. Atik Naik has raised the point of rat bite. किसी को प्री डायबिटीज है साथ में रैट बाइट हो गया या फुट अल्सर हो गया you are awaiting surgery and you want excellent control before surgery, after surgery. If you have a wide spectrum of metabolic diseases, not only pre-diabetes, you also have a family history of heart disease. You also have obstructive sleep apnea. You have fatty liver. So a wide spectrum. And if you are self-motivated, you want the best for yourself. You want the best for your family. So severity, symptomatic pre-diabetes, associated sickness or surgery, a wide spectrum of complications, and self motivation. In all these, you can take these medicines. And like we said, metformin, pioglitazone, acarbose, these are the commonest ones, of which metformin is the one that is used most frequently. It is the most economical. So, in such situations, we can take medication. I apologize that we have not been able to take all the questions. आज का हमारा topic था pre-diabetes, and we have to let Dr. Rakesh free also today. But it's been great having you, Dr. Rakesh. सबको thank you बोलूंगा for all the questions, and हम आपके साथ लगे ही रहते हैं every day of the week with KK Med Talks. But Dr. Rakesh, any single take-home message you would want to give to everybody who's watching us?
So I think the single take-home message that I would tell everybody is that they should at least have a test for glucose done at least some time or the other, and take action on that. If you have got a normal value, then it is important that you maintain it like that. If you've got a value which is in the range of pre-diabetes, you certainly have a lot of opportunity to prevent diabetes. And if it is by any chance, if it is higher than normal, and if you are in the range of diabetes, still you can do a lot to prevent all the problems and live a healthy life with diabetes also. So that is what I would say, that it is important that you get your blood sugar tested, and see that you know what is the status, and you maintain a good health.
And view pre-diabetes as a platform to promote health.
Promote health.
Gurvinder ji and Pat ji, Dr. Rakesh Sai had been with us a few months ago, and his topic at that time in KK Med Talks was steroid stewardship. So many questions on steroids and post-COVID diabetes. Please search for the recordings, which are easy to find. KK Med Talks with Dr. Rakesh Sai a few months ago. It's been great having you, sir, with us. Manmeet, could we show a certificate of appreciation to sir?
Thank you.
So thank you, Dr. Rakesh, and thanks to everybody. केके मेड टॉक्स आपके साथ रोज होता है शाम 7 बजे. मैं आपके साथ होता हूँ हर सोमवार और वीरवार, एवरी मंडे एंड थर्सडे. मगर इस थर्सडे हमारे स्पेशल एंकर हैं, वो हैं डॉक्टर विन्नी कंट्रो फ्रॉम अपोलो हॉस्पिटल न्यू दिल्ली. और हमारे सुपर स्पेशल गेस्ट हैं, वो हैं डॉक्टर ध्रुव चौधरी, बहुत सीनियर प्रोफेसर हैं फ्रॉम पीजीएमएस रोहतक. ये बात करेंगे सीओपीडी, क्रॉनिक ऑब्स्ट्रक्टिव पल्मोनरी डिजीज के बारे में, बिकॉज 18th इज इंटरनेशनल सीओपीडी डे. मैं आपके साथ फिर मिलूंगा 22 तारीख को, अ वीक फ्रॉम नाउ. और हमारे तब भी जो गेस्ट हैं वो हैं फिर से हैदराबाद, फ्रॉम द ब्यूटीफुल सिटी ऑफ हैदराबाद, एंड वो हैं डॉक्टर अभिषेक कटकवर. ही विल बी स्पीकिंग अबाउट बैरियाट्रिक सर्जरी, वजन कम करने के लिए जो ऑपरेशन किया जाता है उसके बारे में वो हमें बताएंगे, कब करना है, कब नहीं करना, क्या कराना है, क्या नहीं कराना. तो इसी में हम लगे रहेंगे. दिस इज एन ऑन गोइंग प्रोसेस, जर्नी टुवर्ड्स गुड हेल्थ एंड हैप्पीनेस. I'd like to thank all of you for being with us. Jai Hind.
Jai Hind.